A leading private healthcare provider, Netcare, has recently announced it will be shutting down maternity and pediatric facilities in Ballito. It says the closure is due to the declining demand for the services. But the South African Society of Obstetricians and Gynecologists, that's SESOG, has condemned the decision. It believes demand for maternity services at the hospital is likely to rise in the future. But to talk more about this, I'm now joined by the president of the South African Society of Obstetricians and Gynecologists, Dr. Haynes Van Der Merwe, this morning. And Doc, thank you so much for your time and good morning to you. Well, we saw the statement there released by Netcare saying there seems to be a dwindling patient demand within the community of Ballito, and that informs their decision to shut down their maternity facilities. I mean, what is your view of this? Is this a fair enough reason?
Well, from our side, we really don't think so. We do realize and recognize that the demand for obstetric services in the hospital did not meet the supply of beds. But we are very disappointed in their announcement. First of all, we are disappointed in the way that Netcare handled this whole matter in announcing it to our members. They were not at all aware of their plans to repurpose the unit. And we also think that there is quite a substantial demand for obstetric services in the region. And although we've seen that the birth rate in South Africa has declined over the last 8 years, we think that that might not be the case in that specific area, because there are reports out to show that specifically Ballito and the Umhlanga area is some of the towns in South Africa with the largest potential for growth.
So what is going to happen to that community of Ballito, as well as some of your members and some of those specialists and doctors practicing, of course, at Netcare?
Well, the doctors were informed that the maternity unit will close down at the end of April in 2023. There is no alternative given to them, so there won't be any obstetric services in that hospital anymore. And the population of Ballito will have to seek obstetric care elsewhere. We believe that the closest towns are about 25 to 30 minutes drive away from Ballito. So we really think that Netcare is letting down the community as well.
Have you engaged Netcare, Doc? And if so, have they responded? What's been your engagement so far since this announcement was made public?
Well, we haven't engaged Netcare yet, but that is our plan. We would like to set up a meeting with the management of Netcare to discuss this, and maybe to look at other options, to maybe just reduce the size of the maternity unit so that there is still a maternity unit in the hospital, and that some of the beds that are currently in the maternity unit are repurposed for other services. I have to agree, we cannot expect Netcare to run a unit that is not financially sustainable, but we are not sure that they really considered all the options available to retain a maternity unit, so that the 5 obstetricians that are working in the hospital can continue their practice.
Right, because, you know, some may argue that this was purely a business decision, because according to my understanding, they're repurposing it, rather that facility that was meant for maternal and neonatal facilities, it is now going to become more for adults and teenagers, for mental health services. For anyone perhaps who is in Ballito right now, and maybe this conversation, they're hearing it for the first time, and is one for concern, are there any other alternatives besides Netcare where they can receive, any maternal services?
Not in Ballito. I don't know the demographics of the area that well, unfortunately, but I believe there is a hospital in Stanger, which is some distance away from Ballito, and then Umhlanga and Durban. But there is no, in Ballito itself, there is no other obstetric facilities available.
All right, we'll leave it then. I appreciate you speaking to us. Dr. Haynes Van Der Merwe, President of the South African Society of Obstetricians and Gynecologists. Well, we'll try and get a hold of Netcare to get their response, of course, to the comments made by SESOC. Not happy with this decision and how, of course, their members were informed, and also saying the community of Ballito is a growing community that is very much dependent on those facilities. Because with media reports yesterday reporting on this story, you could have seen a group of community members out in Ballito protesting, saying they still needed those services and they weren't too happy. So we'll try and get a hold of Netcare to give them a right of reply. All right.